So what are the benefits of what we've been trying to do? So we have applied this process to our transformation programme. It's not across all of the organisation. So it's not in all our other priorities. So the deployment matrix, the exec team like, and they've adopted it and they want to use it for our other priorities. Great stuff, because that will really help. We've got that strategy converted into site improvement plans. When we started off, we were pushing those, filling them in, and now we've transferred those to the owners of the sites, so the senior managers and clinicians. It's their plan, and they can put on it what they want as long as they're meeting the priorities from the deployment matrix. The monthly board meetings will now use video conferencing. We are coaching people, their middle managers, matrons and our business managers in how to prepare for that meeting, and particularly around making sure that the actions from those meetings are focused and rapid. We've heard from Paul that we are doing what we call management walks, which we are getting people out of their offices, understanding why they're busy, getting to the root cause of that, and helping them to go to the workplace as part of this catchball process, where they go to see the issues. And they may go, if it's a ward sister, you'd expect them to go every day. If it's a matron or a business manager, you may expect them to go every week. And if it's a very senior manager or an exec, they may come once a month or once a quarter. But they come with the same questions that we heard this morning. How are you doing? What's your plan? What are you working on? What can we see and what can we expect? And when will you deliver? Crucially, we're leaving people to do the work in the workplace, and we're getting managers to that workplace. So what's next? We've learnt loads, absolutely loads. If anyone wants to know how not to do it, come and talk to me, because I can tell you chapter and verse. We started off planning for our strategy deployment matrix in the middle of a year, and trying to assign financial savings to it was really difficult. Taught us about how we link our finance to our improvement, or how we don't, and how difficult that can be. So now we started our 13-14 plan already, and we're now linked into our finance department so that they can help us to understand, don't forget I've got this target of 14 million, where that's coming from. We started the rigour in which we now manage the process is much greater. And I think that has an implication that it starts to shift the work, that kind of the ownership from an improvement team into the teams, the operational teams. It becomes their work, and they go and are accountable for it. It started to become the way we work, and it's not just another improvement initiative. So hopefully one day we will be able to apply it to everything and not just transformation. If you're going to try and do something like this, what would I recommend? I think the first thing, is which a number of people have talked about, is to know your audience and use their language. And that will vary in the organisation between the staff group you're talking to. So I wouldn't go to doctors and use any of this language. I'd probably have a chat over a cup of coffee, and then several times later I might get to the bit I really want. When I'm going to a ward nurse, then it's what's in it for them, for all staff groups. But the language is key, and it is different at exec level to it is at the workplace. Don't do what we did and listen to the execs. I think it's important to use improvement principles and stick to them, because actually we've had far more success in doing that than we had when we decided we'd do it their way. Use strategy deployment. It's a really good tool, but it's at the right level. And in our organisation, that's the way it works. Whether that works differently elsewhere, that's absolutely fine. But in our organisation, strategy deployment matrix works at exec level, and I don't take it anywhere else. Translate that into operational reality, and that will depend on the audience again. So we have the site improvement plans, but actually that will be different. Again, if we're going to talk to a consultant body, we will take a different way of translating that plan to that meeting. In our place, busy is endemic, and you've heard about how busy people are, and we need to treat it, and we need to treat it before we can really expect people to deliver. We've heard about CapDo. CapDo and 3-minute reporting and card issues are the two things I'd recommend everyone to go and do. To all meetings. You'd revolutionise the way that you work, and they're relatively simple. Go to the workplace, absolutely. It's so easy to get stuck in an office. Contract with the staff to get engagement, as Jane and Zoe did. And then, lastly, but really crucially, deal with issues rapidly. There's nothing worse than somebody who's taken a piece of work, implemented it, and said, I've done the best I can, but the next thing I need you to do is to go and help me sort out this doctor problem, or whatever it is, before I can move on. And the longer you take to do that, then the less engaged those staff will become, and they'll give up. So we're really now focusing our attention on those management walks, that catchball process, to rapidly get those issues to the right level where they can deal with them. And that doesn't mean that you can just, the ward just gives all their issues to their matron, who gives all their issues to the senior managers. The matron going to the ward is to support, but also say, well, actually, you can deal with that yourself. You know, you don't need me, just do this. Or what's your plan? So most of the issues should be dealt with at the right place. And if there's one or two things that the ward are really struggling with, then they give that to the matron, who then takes the responsibility of acting on that. And that might be to raise it further, if it's a wicked problem, or it might be that actually they take the work on themselves to deal with it. And again, if they get stuck, they can go to the exec level and seek help. And again, it might be you can deal with that yourself. So we don't want all our issues going to the top. That's not the way to manage this, is to provide support and challenge at the right level.